My name is Lachlan Voss, and today I'm presenting my Capstone project, a mixed method study of the efficacy of complementary and alternative medicine in the promotion of health and prevention of disease. Complementary and alternative medicine, or CAM, continues to grow. It reflects broader concerns with a healthcare system that often prioritizes symptom management and pharmaceutical intervention over long-term prevention and whole-person care. Integrative approaches seek to address this gap by emphasizing patient-centered care, attention to physical, emotional, and behavioral health, and stronger patient-provider relationships supported by improved communication and longer visits. This mixed method study examines healthcare provider perspectives on CAM when integrated with traditional allopathic medicine, with a focus on health promotion, disease prevention, and chronic disease management. Existing literature consistently demonstrates that CAM supports care models addressing physical, emotional, mental, and even spiritual dimensions of health, rather than disease alone. Integrative care prioritizes prevention, long-term wellness, and patient engagement, shifting care away from strictly reactive and symptoms-based treatment. In contrast, conventional care may limit patient satisfaction due to short appointment times and reduced opportunities for shared decision-making, which negatively impact communication and trust. Importantly, research shows that when providers are open to discussing CAM, provider-patient relationships improve, and patients report higher satisfaction with care. These findings highlight why examining provider perspectives is essential, because providers directly influence whether integrative approaches are acknowledged, supported, or even incorporated into clinical practice. Additionally, research shows that CAM use is particularly common among older adults and individuals with chronic health conditions, with most patients using CAM as a complement rather than a replacement for conventional medical care. Patients often seek CAM due to dissatisfaction with traditional care and a desire for treatment approaches that reflect a more holistic understanding of health. CAM utilization is shaped by a multitude of factors, including cultural beliefs, access to services, health literacy, and even disease severity, highlighting the complexity of healthcare decision-making. And while existing evidence supports CAM's role in health promotion, disease prevention, and chronic disease management, much of the literature is limited by small sample sizes, self-reported data, and limited generalizability. Thus, these gaps underscore the need for further investigation, particularly research focused on provider perceptions, which this study directly addresses. Gaps. This study employed a mixed method survey design guided by the research question, how do healthcare providers perceive the role of complementary and alternative medicine in promoting health and preventing disease? Likert-style questions assessed provider beliefs across key domains, while open-ended responses provided qualitative insights. The survey was distributed anonymously via Qualtrics to licensed healthcare providers and facilities in both urban and rural settings. After data cleaning, 23 fully completed responses were retained for descriptive analysis using Microsoft Excel. Strong support for the integration of CAM into patient care. Regarding patient engagement, 73.9% of participants strongly agreed that incorporating CAM encourages patients to engage more actively in health-promoting behaviors. And in the context of prevention, the majority of providers strongly agreed that CAM supports stress management, physical activity, and nutritional awareness, reinforcing its perceived value in preventive care. CAM was also viewed as beneficial when combined with conventional medicine for long-term prevention and chronic disease management, supporting its role as an adjunct rather than a replacement. Lastly, over 60% strongly agreed that CAM contributes positively to overall patient well-being and quality of life. Together, these findings suggest that providers view CAM as a very meaningful component of patient-centered and preventive healthcare models. key directions for future research emerged. Future studies should include a broader range of healthcare providers and more diverse practice settings, expand provider representation, and move beyond self-reported perceptions and examine objective outcomes, including patient health outcomes, treatment adherence, and engagement in preventative behaviors for greater generalizability. Overall, providers viewed CAM positively, particularly for its role in health promotion, disease prevention, patient engagement, and shared decision-making. And thank you for listening to my presentation.